Did you know that over 500 million people worldwide are living with diabetes, and many don't even know it yet? In fact, according to the World Health Organization, diabetes is one of the fastest growing health challenges, with millions of new cases being diagnosed every year. But here's the real question. Could you or someone you care about have diabetes without realizing it? Diabetes often develops quietly, with symptoms that can be mistaken for something else or completely overlooked. In this video, we'll break down the most common signs and symptoms of diabetes so you can recognize them early. From frequent thirst to unexplained weight changes, your body could be trying to warn you. Early detection is key to managing diabetes effectively and preventing serious complications. So if you've ever wondered about the warning signs, stick around. This could be the information that makes all the difference. First of all, let's dive deeper into understanding diabetes and its impact on health. Diabetes is a condition that occurs when your blood sugar levels are too high due to problems with insulin, which is a hormone produced by the pancreas. Insulin acts as a key, helping glucose enter your body's cells for energy. If your pancreas doesn't produce enough insulin or your body doesn't respond to it properly, glucose builds up in your bloodstream, leading to hyperglycemia. Over time, this can result in complications such as heart disease, nerve damage, and vision problems. There are several types of diabetes, with the most common being type 2 diabetes. This form typically affects adults but can also develop in children. It occurs when your body becomes resistant to insulin or doesn't produce enough of it. Type 1 diabetes, on the other hand, is an autoimmune condition where the immune system attacks insulin-producing cells in the pancreas. Other forms include gestational diabetes, which occurs during pregnancy, and rare types like neonatal diabetes and brittle diabetes. Prediabetes is a precursor to type 2 diabetes. It is also significant as it can be reversed with lifestyle changes. While most forms of diabetes are lifelong, they are manageable with proper treatment and healthy habits. Now let's take a closer look at the key signs and symptoms of diabetes that you should never ignore. One of the most noticeable early signs of diabetes is increased thirst or polydipsia, often paired with frequent urination or polyuria. When blood sugar levels are too high, the kidneys work harder to filter and eliminate excess glucose from the bloodstream. This process leads to the production of more urine, causing frequent bathroom trips. The increased urination results in significant fluid loss, which can leave the body dehydrated and trigger intense thirst. Even if you drink more water than usual, the thirst often remains unrelieved, making it a prominent indicator of diabetes. A dry mouth may also accompany these symptoms due to dehydration. These signs are especially common and pronounced in type 1 diabetes, where symptoms develop rapidly, but they can also occur in type 2 diabetes and other types. If left unmanaged, dehydration can worsen and contribute to other complications, emphasizing the need for early diagnosis and treatment. Next, fatigue and weakness are also prevalent symptoms of diabetes. When the body is unable to properly utilize glucose for energy due to a lack of insulin or insulin resistance, energy levels decrease dramatically. Glucose is the body's primary source of energy, and without it being properly absorbed by the cells, you may feel persistently tired, weak, and unable to carry out daily tasks. Additionally, dehydration caused by frequent urination can make the fatigue even worse. As the body loses fluids, it becomes more difficult to stay energized, leaving individuals feeling drained, sluggish, and unable to focus. This fatigue may not be relieved by rest or sleep, which makes it different from typical tiredness. People with diabetes often experience a constant sense of exhaustion, affecting both physical and mental performance. If fatigue is accompanied by other symptoms like excessive thirst or frequent urination, it could be a sign that blood sugar levels are not properly managed. Unexplained weight loss is another common symptom, especially in type 1 diabetes. When the body is unable to properly use glucose for energy due to a lack of insulin, it begins to break down fat and muscle tissue as an alternative fuel source. This results in rapid weight loss, often noticeable even when a person's appetite increases or they continue to eat the same amount of food. In some cases, people may even feel hungrier than usual, but still lose weight. As the body uses fat and muscle for energy, it also produces ketones, which is a byproduct of fat breakdown. High levels of ketones can build up in the blood, leading to a dangerous condition called ketoacidosis. If left untreated, ketoacidosis can result in severe complications, including coma or death. Unexplained weight loss, combined with other symptoms like increased thirst and frequent urination, should be evaluated by a healthcare professional, as it may signal undiagnosed diabetes. Slow-healing sores and frequent infections are significant symptoms of diabetes, often caused by high blood sugar levels. Elevated glucose can impair the body's ability to heal wounds and fight infections. When blood sugar is too high, it reduces the effectiveness of white blood cells, which are responsible for fighting off infections and promoting healing. This results in cuts, sores, or wounds taking much longer to heal than usual. Additionally, diabetes can lead to poor blood circulation, especially in the extremities, further delaying recovery. As a result, individuals may experience frequent infections such as skin infections, gum infections, or yeast infections, particularly in warm, moist areas of the body. These recurrent infections and slow recovery times are clear warning signs that something is wrong with the body's ability to manage blood sugar and heal properly. If left untreated, these symptoms can lead to more severe complications, making early detection and management crucial in preventing long-term damage. One of the visual symptoms of diabetes is blurred vision, which is linked to changes in blood glucose. When blood sugar is too high, it can cause fluid to shift in the lenses of the eyes, disrupting their ability to focus properly. This can lead to blurry or distorted vision, which may come and go depending on blood sugar fluctuations. Initially, this symptom may seem minor, but if left unmanaged, it can signal more serious eye problems. Over time, high blood sugar can damage the blood vessels in the eyes, leading to diabetic retinopathy, a condition that can cause permanent vision loss if untreated. Diabetic retinopathy occurs when the high blood sugar levels damage the small blood vessels in the retina, leading to leakage, bleeding, or scarring. Early detection and proper blood sugar control are crucial in preventing these complications and preserving vision. Regular eye exams are essential for people with diabetes to monitor and manage eye health. One of the lesser-known symptoms of diabetes is numbness or tingling, often referred to as diabetic neuropathy. When blood sugar levels remain elevated over time, it can damage the nerves, particularly in the extremities, such as the hands, feet, and legs. This nerve damage interferes with the normal transmission of signals between the body and the brain, causing sensations like tingling, burning, or a pins and needles feeling. In some cases, the affected areas may become numb, making it difficult for individuals to feel touch, heat, or pain. This nerve damage can worsen over time if blood glucose levels are not properly managed. Diabetic neuropathy is more common in people with type 2 diabetes, but can also affect those with type 1 diabetes. Regular monitoring of blood sugar and early intervention are crucial to prevent the progression of this complication. Lastly, another symptom often associated with type 2 diabetes is Acanthosis nigricans. It is a condition where patches of skin become darkened, thickened, and velvety. These changes typically occur in areas such as the neck, armpits, groin, and sometimes the elbows and knees. The darkened skin is a sign of insulin resistance, a key characteristic of type 2 diabetes, where the body's cells do not respond properly to insulin. As the body tries to compensate for this resistance, it produces more insulin, leading to changes in the skin. The exact causes of Acanthosis nigricans is not fully understood, but it is often linked to high insulin levels in the bloodstream. While this condition is not harmful on its own, it can be an early indicator of diabetes, and people with these skin changes should get their blood sugar levels checked. Proper management of diabetes and insulin sensitivity can help improve the appearance of the skin. Moving on, when it comes to diabetes, the underlying causes can vary depending on the type. In type 2 diabetes, insulin resistance occurs when cells in the muscles, fat, and liver become less responsive to insulin, often due to factors like obesity, lack of exercise, poor diet, and genetics. In type 1 diabetes and LADA, the immune system attacks insulin-producing cells in the pancreas, causing insufficient insulin production. Gestational diabetes occurs during pregnancy due to hormonal changes. Physical damage to the pancreas can lead to type 3C diabetes. Additionally, genetic mutations and long-term medication use can also contribute to the development of diabetes. To reduce the risk of developing prediabetes, type 2 diabetes, or gestational diabetes, there are several lifestyle changes you can make. Eating a healthy diet, such as the Mediterranean diet, staying physically active for at least 30 minutes a day, and maintaining a healthy weight are key steps in preventing diabetes. Managing stress, limiting alcohol intake, getting adequate sleep, and quitting smoking also play important roles. Additionally, taking medications as directed by your healthcare provider to manage heart disease risk factors can be beneficial. However, some factors like genetics, family history, age, and race are beyond your control. Recognizing the signs and symptoms of diabetes is crucial for early detection and effective management. Whether it's increased thirst, fatigue, blurred vision, or slow-healing sores, these symptoms can provide important clues that your body may not be functioning properly. If you notice any of these signs, it's essential to consult a healthcare provider for further evaluation. Early diagnosis and intervention can help prevent complications and improve quality of life. By staying informed, you can take steps to manage or reduce the risk of diabetes effectively. Thanks for watching, and remember, your health is in your hands.